Welcome to the Evolve Lactation podcast. I'm Christine Staricka, a board-certified lactation consultant in the U.S., and I create strategic lactation education for professionals who refuse the status quo. If you are involved in supporting and advocating for breastfeeding and human lactation, meet me here on the podcast for insights and encouragement. I've had a unique career in breastfeeding support, working in multiple types of settings, and I enjoy sharing my thoughts and observations with you. This podcast is about solutions, not complaints. It's about finding ethical, resourceful ways to solve problems and continue adapting to the ever-shifting landscape in which we work and live. I've got ideas, and I welcome some incredible guests onto the show to talk about their work. Grab your favorite drink or snack and settle in as we begin this next episode of the Evolve Lactation podcast. After completing this lesson, you will be able to identify 3 health outcomes impacted by exclusive human milk feeding in the first 100 hours. Now that includes, of course, exclusive breastfeeding, as well as breastfeeding plus feeding expressed human milk. We want to think about taking every opportunity to empower parents with information, and we tend to think about this in terms of offering them techniques and tools that will help them navigate the first few days, the first few weeks of breastfeeding. And of course, that's extremely important. We also want to make sure that we're taking every opportunity before their baby is born to give them the information that they need to really understand what the commitment and the idea and the premise of breastfeeding truly is. We want people to approach it having thought about it and decided what their vision is for how they're going to feed their baby. Not only what is that going to look like? Will it be easy? Will it be hard? What will I need to do specifically? But also, why are they doing it? Thinking about what their intentions are. Why do they want to feed their baby only their milk? Why do they want to put their baby to the breast? These are not always things that people think about. Sometimes people make these decisions based on other things that they've heard, what other people say they should do, what they think they're supposed to do. And the more time they can actually be encouraged to spend thinking about it, considering it, talking about it before the baby is born, the more of an idea that they'll have about how they feel about it and how important it is to them. So by giving them information at absolutely every opportunity that we have, we're going to give them those chances to really think about it and spend time, setting their intentions for what this experience is going to be like for them. We're familiar with the way that we usually approach talking about the importance of breastfeeding. And it's very common to hear people talking about the benefits or advantages. I don't really use those words. I prefer to use words that discuss the importance of breastfeeding, because breastfeeding as the physiological norm shouldn't really be positioned as something that has benefits. It shouldn't be positioned in that way, because then it makes it sound like something special that you can pick, and that's not what it is. It is the normal physiological way to feed a baby, and making choices other than that are the ones that we should be talking about what the outcomes of those are. But let's start here with thinking about the health outcomes that we're used to hearing about. And then we'll talk about why these are important, as well as why it may be helpful to approach health outcomes in a slightly different way with a different scope of focus. So we think about what kind of outcomes the baby will have when they receive exclusive human milk feeding. And of course, one of the top ones that we think about is protection from infection, both in the beginning as well as throughout the rest of their lifespan. We think about the establishment of the microbiome by putting the proper organisms into their gut and by allowing those to flourish versus pathogenic organisms. we're allowing them to develop normally. We think about development of the infant in terms of their facial structure, the way their muscles work, the way their body is held and is used during breastfeeding. All of these things are important for development, as well as the nutritional building blocks they receive through human milk. And the protection from infection that they get allows them to develop according to their body's plan versus having to develop in the context of also being sick or overcoming being sick. So there's a lot of ways to think about how those things all play together. They're also developing social skills and interaction with human beings during breastfeeding that they don't always get if they're not being breastfed, unless parents are given the information that they need when they make other feeding choices to ensure that they fulfill those needs for their babies. Now, health outcomes for mothers and parents who are breastfeeding and chest feeding, they are also things that we can focus on, and we can give information about how the process of lactation helps to decrease the risks of multiple types of cancer and metabolic diseases. It has a lot of long-term effects on adult health. And this is, of course, less of a focus generally in mainstream talk about the importance of breastfeeding, but it is a really crucial thing. And so, of course, for some people who already perceive that they have higher risks of these things, perhaps they feel there's, genetic components that they do want to do everything they can to overcome. This is going to be something that attracts their attention. And if they're already, of course, suffering something like metabolic disease or anything cardiovascular, they may be familiar with why it would be important to, use any intervention that they can to prevent that from getting worse or possibly even to make it less harmful for them. Those are things that are very long term. They seem very vague and abstract to a lot of people. When you're 21 years old, 24 years old, even 27 years old, you're not always thinking about your risks of these things, these types of conditions, these types of diseases later on. It's not always the most motivating thing to think, I'm going to breastfeed my baby now so that later on I'll have a decreased risk of cervical cancer. It may be true, it may be factual, but it's not always going to be the most motivating thing for you when you're younger and your focus is so much on your baby. And of course, we know that there are important health outcomes in the mental health of both infants and parents that are outcomes of exclusive breastfeeding and exclusive human milk feeding. Very important for both. The structure of how that feeding is happening lends itself to normal social human interaction, which is very supportive for both of them to go through the bonding and attachment processes that they are supposed to. It's part of developing the self-identity of the parent as a parent. Mothering and matrescence are a whole process, a series of things that happen, and breastfeeding is an important foundation of that. However long breastfeeding goes on, it's an important foundation of matrescence, that becoming a mother. So these are the types of things that we tend to hear focused on when we're giving people information about why should they breastfeed? Why should they think about breastfeeding? Why should they be preparing for breastfeeding? And again, these are a lot of things which tend to look a bit vague and abstract and long-term to people who are very focused on themselves and their baby right now. What is this going to look like for me right now? Like, they might even look at some of these things and think, I want all of those outcomes, but this is really hard right now. So we want to give them the tools that they need to help to understand what breastfeeding means in a different way. And one of the ways that we can do that is by providing them information that is more short term in terms of the outcomes that they can expect. So it may be helpful when we're focusing on the first 100 hours to really think about these outcomes that are tangible right now. So, to think about having an exclusively breastfed baby for the first 100 hours, here's what we're going to focus on now. Let's think about the baby. Let's break it down the same way we just broke down the other health outcomes. We're looking at a healthy baby who's had no exposure to foreign proteins or pathogens from the use of formula. By making sure that they get only human milk, we know that they're getting only human milk. No pathogens or foreign proteins like cow protein, goat milk protein, any other kind of proteins, or even soy, which is in regular standard formula. The baby isn't getting exposed to any of those things during these first 100 hours. And that's really important because this is an important time frame for establishing all those things we talked about before. When it comes to development, epigenetics, microbiome, we want to make sure that the baby's genes are able to be expressed the way that they were designed and planned to without having these exposures, which are definitely going to impact the microbiome. Then when we think about the mother, we are going to see with exclusive human milk feeding in the first 100 hours that the mother has a lot of experience actually breastfeeding and a lot of experience actually expressing her own milk. These are really important outcomes. So when we support the techniques of making sure that babies are being brought to the breast, they're being held skin to skin, and milk is being expressed by hand without the use of any tools, these experiences are tangible in the moment. They're something that people feel, and they're having this memory of actually doing it so that these are tools they can return to later on. But when they get to do these things right away and they get to do them repeatedly, they gain all of this practical knowledge about how to continue doing it so that should they get to a point, a week down the road or 2 weeks into their baby's life, and they're thinking, this is really hard, they're making that decision based on they're actually doing it, not a decision based on breastfeeding in general is hard because I've had to do all these things. They're making a decision based on this is what breastfeeding is. It's putting the baby to the breast. It's expressing your milk. It's knowing that your milk is going into your baby. When they get to do those things, rather than thinking of breastfeeding as breastfeeding plus pumping plus checking on this plus bottle feeding plus worrying about that, that whole experience becomes overwhelming. What we want them to have, especially in these first few days, is just this pure experience of actually holding their baby skin to skin, breastfeeding them, and hand expressing. And then overall, we can see that because a mother is breastfeeding and expressing their own milk through these first 100 hours, they learn to problem solve in ways that help them gain experience with things like positioning their baby for feeding, getting themselves comfortable in positioning, latching the baby differently, what to do if they are feeling doubtful or concerned about something. They know that the response is put my baby skin to skin, let my baby latch, help them if they need it, express my milk and feed it to the baby. It helps them to build this knowledge that they can do it and that people can help them. And that helps to ensure that they have more motivation to seek needed supports as time goes on. Should they run into problems later on beyond the first 100 hours, they have that memory. When I had a problem before, I relied on myself. I relied on what I tried. And when that wasn't enough, I asked for help and it helped me. It helped me get past that problem. Maybe not magically and immediately in the moment, but it helped me overall to know that I could get back to where I wanted to be. So as we support people to follow this plan where they are just breastfeeding and just feeding their own milk, this is what builds that self-confidence about breastfeeding, about their ability to continue feeding their own baby, and also that motivation to continue to get help if they should need it, both now and later. What most people find actually out in the world is that if they run into problems in the first 100 hours and beyond, what a lot of people tell them, and sometimes this is out of the best of intentions, is that they should just pump. It's people say, well, this is just going to be easier, which we all know that it's not necessarily easier, and it's not necessarily easy in the first 100 hours anyway. People will also tell them to just give formula. Well, that comes with its own set of different outcomes, as well as teaching people that the answer is not within them. The answers really truly are within them, but when they are encouraged to give formula, it can make them feel as if the answers are outside of them. And we really want people to build resilience and self-efficacy around that confidence they have gained from actually breastfeeding. And then, of course, there's people who will tell them to just stop breastfeeding if it's hard, if it's concerning for them, if it's not going easily, it's not a straightforward process for them. And when we tell people to just stop breastfeeding, that can feel like a great solution in the moment, but it doesn't make the desire to breastfeed go away. Just because it's hard and we stop doesn't mean that we don't want to do it anymore or we won't regret stopping. So these are really dangerous, disrespectful messages for people in general, but they're especially dangerous for using in the first 100 hours because these things really, really complicate the situation. When we tell someone in the first 100 hours to use a pump, how are they going to know how to do that? Do they have access to pump equipment that's appropriate for that time frame? What kind of techniques do they have? That's a really complicated skill to learn at a time when you're already worried and your body and your brain are supposed to be doing something completely different, not learning a skill that involves equipment and things like that. Really supposed to be nurturing the baby, recovering from childbirth, and feeding the baby. Those are the times for rest and recovery and nourishing the baby. And when you have to learn a new skill, that is pretty disruptive to that whole process. The same with formula, on top of the fact that using formula during these first 100 hours, of course, as we know, has those sort of outsized impacts on the microbiome. Because the baby gets so little volume during that time, the more of it that's formula, the harder that is on their system. And then, of course, the advice to just stop breastfeeding that early on is not really useful for anyone. We want them to have the experience of breastfeeding. Even if they are having challenges, we want them to still experience it as much as they can, as much as they want to, and be able to improve it rather than just stop it if what they really want to do is to breastfeed long term. So this is just a slightly different way of looking at what kind of information we should be consistently sharing with people as often as we can before they're pregnant, while they're pregnant, and during that first time after birth, those first few days, those first 100 hours of breastfeeding. Thank you for listening to this episode of the Evolve Lactation podcast. If today's conversation sparked something in you, whether it's a new strategy you want to try, a policy you want to challenge, or simply the reminder that you're not alone in this work, take that energy and run with it. Remember, real change happens when committed professionals like you have the resources and community support to act. Join my community at evolvelactation.org for ongoing discussions, exclusive free resources, and connection with other people who are doing this important work alongside you. You can find all the links in the show notes and connect with me on Substack or LinkedIn for more insights and updates. Whether you're just starting your lactation journey or you've been advocating for families for years, your voice matters. Your expertise matters. And together, we're not just evolving our individual practice, we're transforming the entire system. Until next time, keep evolving.